Hello, everybody. My name is Ainsley Reynolds, and today I will be talking to you guys about a couple of different complementary nutrition therapies that have been clinically studied and can help treat different symptoms of schizophrenia. First, we will learn a little bit about what schizophrenia is and how it affects people, and then we will look at some different studies that delve into how these different complementary nutrition therapies can be effective. First, we will look at the overarching disease category that I chose, which is mental disorders. The broad disease category is psychotic disorders, and schizophrenia falls within this category. Schizophrenia can be defined as a mental health disorder that affects how people think, feel, and behave. This is a very relevant disease as it impacts millions of people all throughout the world, and it also has one of the highest mortality rates among all mental disorders in general. It falls within one of the top 25 most impactful mental disorders that exist, and it impacts all areas of life. This means that it impacts cognition, physicality, one's social life, one's ability to take care of themselves, and much more. It typically shortens people's lifespans by about 9 years when compared to others who do not have schizophrenia. Now, to look at some important facts about schizophrenia. One of the most important factors is that it causes psychosis. This involves states of delusions and hallucinations as well, which means that people who have schizophrenia may see things that are not there, they may hear things that are not there, and they may convince themselves of truths that are not actually taking place within reality, such as being watched, being surveilled, and many more. Now, while this disorder does require lifelong treatment, at least a third of the people who have schizophrenia can experience a complete remission if treatment is consistent. When people who have schizophrenia typically find out that they do have it, it is usually within their adolescence, late teens, throughout their 20s. That is usually when symptoms start to present themselves and a diagnosis is able to take place. Unfortunately, those who have schizophrenia are also more likely to experience cardiovascular, metabolic, and infectious diseases. In order to diagnose schizophrenia, a mental health care professional must complete this. They typically, at least when diagnosing within the US, use the DSM 5, which is a manual or guide encompassing different statistics, information, and criteria involving all of the different mental disorders that exist. In addition to a mental health care professional's diagnosis, a healthcare professional might be useful in order to receive a MRI or CT scan to help further diagnose. We will see much later on in the presentation how a brain scan of someone who has schizophrenia versus somebody who does not varies significantly. Some common treatments for schizophrenia include antipsychotic medications, therapy, as well as rehab in intense situations. Now for the epidemiology of schizophrenia. Schizophrenia impacts approximately 23 million people worldwide, which translates to about 1 in 345 people, or 0.23% of the world population. In terms of adults, 1 in 233 people are affected, or 0.43% of the worldwide adult population. It is slightly less common than other mental disorders, but nonetheless, it still is one of the top 25 most impactful mental disorders out there. Symptoms typically show up earlier within women, but again, all people typically start to experience symptoms from late teens to late 20s. Now for some pathophysiology of schizophrenia. The first part of this involves dopamine. Presynaptic dopamine dysfunction is known to mediate psychosis within schizophrenia. This simply means that dopamine is not processed and utilized the same way in a brain that has schizophrenia compared to one that does not. There are less synaptic connections within a brain that has schizophrenia, so this impairs its ability to utilize dopamine in its most effective ways. This connects to the fact that alterations within the striatum in terms of dopamine function contribute to the delusions and psychosis. These are also connected to the thalamus, which is linked to the cerebral cortex, the amygdala, and the hippocampus. All of these changes and dysfunction within this network overall is what causes and contributes to hallucinations and delusions in patients experiencing schizophrenia. Now that we know a little bit more about the disease itself, we can get into a couple of different complementary nutrition therapies that can potentially help treat the symptoms of schizophrenia. The two that I will be focusing on in this presentation are omega-3 fatty acids as well as probiotics. The first therapy that I will be discussing is omega-3 fatty acids. So, what are omega-3 fatty acids? These are essential fatty acids which fall into the category of polyunsaturated fats, or PUFAs. They are typically obtained from food sources such as fatty fish like sardines, salmon, or mackerel, but they are present within certain plant-based sources as well, such as certain nuts like walnuts, seeds like chia seeds or flax seeds, as well as soybeans. They come in DHA and EPA forms. Then, what are their main purposes? Their main purposes that we are familiar with for the most part are heart health, brain function, as well as anti-inflammation. A couple of the mechanisms of omega-3 fatty acids within schizophrenia are that it enhances antioxidative intracellular defense systems, and it also targets pro-inflammatory cytokines such as interleukin 1, interleukin 6, and tumor necrosis factor alpha. Omega-3 supplements are generally recognized as safe. However, there is a potential for a fishy aftertaste or heartburn. There's also common reports of fish burps if you are taking it in the form of fish oil, which does typically tend to be the most common form of an omega-3 supplement. There are some potential interactions, such as with anticoagulants, contraceptives, as well as vitamin E absorption, if they are taken in extreme amounts. Now let's get into the first study dealing with omega-3 fatty acids. This study was designed as a randomized control trial, and the participants consisted of 80 patients with schizophrenia. It was based in 3 psychiatric hospitals within China, and it lasted for 12 weeks. One group received 2,400 milligrams of fish oil, and the placebo group received 100 milligrams of vitamin E. The results showed that omegas had a beneficial impact on cognitive function as well as delayed memory factor. A couple limitations within the study were that it was a pretty small sample size and the duration of the study overall was more on the short side. In terms of side effects, none were assessed nor reported by any of the participants. While the first study looked at cognitive impacts, this second study looks more at omega-3 fatty acids effects on the physical. So this design was also a randomized controlled trial, and the participants consisted of 56 patients also diagnosed with schizophrenia. This setting was in Hijazi and Ibn Sina hospitals, and it lasted for 8 weeks. The methods included 1,000 milligrams of omega-3 in the test group, and for the placebo group, they received olive oil. The results showed a significant improvement in waist circumference, and the limitations, similar to the first one, were that it was a short duration and a small sample size. There were no side effects reported, and the reason that we looked at waist circumference was because the drug that was already being administered to subjects was clozapine, which is known to make developing fat in the midsection much easier. However, because of the omega-3 fatty acid supplementation, they did see beneficial results in terms of waist circumference. The third study was also a randomized controlled trial consisting of 71 patients with schizophrenia. It took place within 3 medical institutions in Poland, and this one lasted for 6 months. The methods consisted of administering 2,200 milligrams of omega-3 fatty acids to the test group, and similar to the second study, the placebo group received olive oil. The results revealed an improvement in symptom severity, general psychopathology, depressive symptoms, level of functioning, and clinical global impression. One limitation of this study was that it lacked a measure of adherence, meaning that they were unable to really check and see if all of the subjects were taking their supplements every day, since there is no way to test a blood serum count for omega-3s. There were no side effects reported for this study by any of the subjects. Now to evaluate the efficacy of omega-3 supplementation for schizophrenia. When looking at these 3 studies, there were consistent beneficial outcomes. There is, however, still a need for studies with larger sample sizes and studies with a longer duration so that we can see long-term effects and if they get better or worse. There is also a need for testing of other forms of omega-3s, meaning besides fish oil, since in all of these studies, fish oil was the form of omega-3s that were administered. There are plant-based sources, such as algae oil, omega-3 supplements. In terms of safety, it was maintained across all studies, and there were no negative side effects reported among any of them. The next therapy that we will be looking at is probiotics. So what are probiotics? Probiotics are live microorganisms, oftentimes known as good bacteria. They can typically be obtained from food sources. This includes fermented food or drinks, so this can include yogurt, kimchi, kefir, even certain pickles, kombucha, and more. The common strains of probiotic bacteria are the lacto and bifidobacteria strains. There is a wide variety of benefits posed by probiotics, but the main ones are often recognized as gut health, immune support, and digestive health. Oftentimes, people will buy probiotics to help with symptoms such as bloating, constipation, diarrhea, and immune benefits come out of this due to our gut microbiome being central to pretty much every other process that goes on within our body. This is why the gut-brain axis is involved, and even factors such as mood can be impacted by probiotics. So that moves us into the mechanisms within schizophrenia. It regulates inflammatory responses, and like I mentioned about the gut-brain axis, it is able to improve cognitive markers due to this concept. In terms of safety, probiotics are generally recognized as safe. There are minimal and rare risks associated with probiotics and immunocompromised populations. The first study that we're going to be looking at for probiotics is a randomized control trial consisting of 70 patients with schizophrenia. The setting was the Razi Psychiatric Hospital of the University of Social Welfare and Rehabilitation Sciences in Iran. It lasted for 12 weeks, and the methods included a probiotic capsule made up majority of lactose strains for the test group, while the placebo group received a starch capsule. The results showed a significant increase in Montreal Cognitive Assessment, or MoCA, scores. The limitations of this study were listed as not assessing vitamin D status before study, and for the sake of this project, there is a limitation considering that it was administered alongside vitamin D, so we can't truly know what was due to probiotics alone or what was due to probiotics combined with vitamin D. But in terms of side effects, none were reported. The next study looks at how probiotics can impact the level of Candida albicans within the body. Candida albicans is a yeast that is also a type of common fungus found within the body. It can be harmful, and this was found to be present within many patients that have schizophrenia who also had GI unrest. So that is why it is significant for this study. It was a randomized control trial, and 65 outpatients with schizophrenia were the participants. There were weekly meetings, and it lasted for 14 weeks in total. The test group received a probiotic, which was a mix of lacto and bifido strains, and then the placebo group received a placebo capsule. The results showed that C. albicans levels lowered in males, and there was an increased positive psychiatric symptom score for the overall group. The limitation was the sample size, and no side effects were reported. The final study was also a randomized control trial. This study contained 131 patients who either had schizophrenia or bipolar disorder. The setting was a research center, but it also consisted of home visits as well as virtual meetings due to it being during COVID. It lasted for 3 months, and the test group received probiotics combining lacto and bifido strains, while the placebo group received a placebo capsule. There was no efficacy on symptom severity, unfortunately, but there were some borderline improvements on cognitive markers. A limitation was COVID restrictions, but no side effects were reported overall. Now to evaluate probiotic supplements for treating schizophrenia. While some of the results were promising, ultimately they were mixed depending on what exactly was being tested. It was safe throughout all studies, but there is a need for longer studies nonetheless. It is unclear as to what the overall efficacy is due to the variety of bacteria strains throughout so many of the different probiotic supplements that are out there. So it is hard to pinpoint which one or which combination can truly be the most helpful. Now for a few recommendations. First and foremost, it is always best practice to speak with a clinician before beginning any supplementation. It is also always important to purchase supplements from third-party tested brands, as well as to do a little bit of extra research on the history of the company to make sure that they are a safe and trusted company that you should be purchasing your supplements from. For omega-3s, it is best to stick to the tested dosages, which ranged from 1 to 2.4 grams per day. And as for probiotics, it is best to utilize a mix of lacto and bifidobacteria strains. For other therapies, there is a handful of other supplemental therapies that are out there that have been looked at for schizophrenia. One of them being vitamin D, as we saw in one of the studies that were included here today. Another one being B vitamins, specifically B6, B8, and B12, since they do play such a role in cognition. Vitamin E is another potential therapy. Melatonin is another one. And N-acetylcysteine, or NAC, is the fifth. As promised, here is a picture of a brain scan on a brain with schizophrenia, as well as a brain that does not have schizophrenia. And this is representing synaptic marker levels. As I mentioned before, within schizophrenia, there is a lack of synaptic function and connectivity, which helps contribute to the main and most common symptoms of schizophrenia, such as the hallucinations and delusions. Here is just a list of my references, and thank you so much for listening. I hope you enjoyed. Bye-bye.